Hello everyone, my name is Felix, and today we're going to be discussing our poster presentation called Amplifying the Voice of Future Physicians, How Medical Student Voting Policy Can Be Improved. And so this research was done by myself, fellow medical student Andy Sivils, and our principal investigator and assistant professor, Dr. Molly Uhlenhake. And so to give a little background information, of the medical students surveyed in a 2018 Harvard Medical School survey, many did not vote while they were on clinical rotations due to lack of time and clinical responsibilities. UMKC School of Medicine does not have a formal policy specific to medical student voting. However, they do have a policy for UMKC employees. Instead of that policy, this past November, they granted an early release from clerkships on the general election day. And so we aim to identify barriers that medical students on clinical rotations face, as well as suggest policy changes for improvement.
The methodology that we used to try to achieve that aim was a survey. Fifth-year medical students on their core rotations were invited to participate in a voluntary survey prior to and immediately following the national election on November 3rd, 2020. That survey was distributed electronically via the Qualtrics platform. Responses were anonymous, and participation in both surveys by each student was not tracked. To clarify, if a student participated in the pre-election survey, we could not confirm that the same exact student also participated in the post-election survey. In terms of our results, of the 117 people in the fifth-year class, 52 and 55 responses were collected on the pre- and post-election surveys, respectively. In the pre-election survey, 94% were registered to vote. We take this number to be a good representation of the fact that this population is interested in participating in elections. From the post-election survey, 96% reported taking less than 2 hours to vote. And so for our first visual representation of our data, on the left side you'll see the representation of our question asking students whether they felt comfortable asking for time off to vote. 76% of students said that they did not feel comfortable asking for time off to vote. On the right side, you'll see that 56% of students said that they did not feel supported by faculty in voting. For the second visual representation, we wanted to assess the actual medical student voting experience on election day. On the left side, you'll see that 91% of students said that they did not experience any obstacles to voting. And on the right side, 92% of students said that their voting was not affected by their clinical rotations.
So what does this mean? This means that voting registration, clinical responsibilities, and time were not barriers to medical student voting participation, and instead, we found that student perception and the reality that they experienced on voting day were slightly misaligned, even though UMKC did provide the 4-hour release from required courses on clerkships. And so our quality improvement suggestion is that a widely disseminated policy that protects voting time for students on core rotations, as well as clear and regular communication from the medical school, would improve student perception. This policy would decrease anxiety surrounding the ability for students to vote and amplify the voice of these future physicians. Moving forward, our team is investigating medical student participation in local elections. Specifically, we want to assess whether there are barriers to voting in local elections for students who attend school outside of their local district. We also plan to include traditional four-year institutions in further research in order to confirm the barriers that students on clinical rotations encounter. We thank you for taking time to listen to our presentation today, and we hope that you are now informed of the barriers that medical students face when voting on core rotations. These data and future quality improvement projects will be useful in creating an informed policy specific to medical student voting in order to amplify their voice. Thank you.